Hello and welcome back to our last video in the series, and welcome if this is your first video. In this video we're going to talk about self-harm and suicide ideation. I do want to put a disclaimer out before I begin the rest of the video. It's just I want you guys to understand that this video is not a substitute to actual treatment. This is for educational purposes only. I strongly suggest if you are self-harming, if you're participating in self-harm, and or you feel suicidal or you struggle with ideations, please go and seek professional help. I know it's very scary sometimes going to speak to a professional, but it's possible to find the right therapist, one that fits you, one that feels comfortable to you, and you can build and create a relationship with that person. So, to start off, we're going to discuss self-harm. It's just basically individuals who purposely hurt themselves, often as a means of dealing with painful memories, distressing emotions, or overwhelming situations. Rather than attempting to ending their life, self-harm is used as a method, a coping strategy to just kind of obtain some relief. And we just talked about coping strategies being, maladaptive or adaptive, or healthy or unhealthy. And cutting is definitely an unhealthy coping strategy. Deliberately hurting yourself is of course dangerous, and it may eventually shift to you having suicide ideation. So not all people who self-harm are suicidal, but it could lead to it, or it could already be there along with the self-harm. So my suggestion again is to go and see a professional and talk these things through. Sometimes because so many people are participating in self-injurious behavior, one of the stigmas is that it's characterized as just attention-seeking behavior. But, it's typically done in secrecy because of the shame they feel. Again, it's a means of coping with related feelings of guilt and remorse. And people will continue engaging in the behavior because of the shame they feel. And so it's just kind of like a vicious cycle. People with anxiety, depression, borderline personality disorder, eating disorders, substance use disorders, and post-traumatic stress can struggle with symptoms of self-harm also. Some of the things that may drive a person to participate in self-harm is it's a way to self-punish. There are people who feel like they don't deserve to live, or they're ashamed of the way they're living, and so they'll administer some type of punishment for them not just kind of adding up to who they think they should be. And that's just one example. That's not the only example. They do it as a way to process thoughts or feelings that are too uncomfortable to express in words. They do it to express suicidal thoughts or feelings without the intention of taking their lives. Some do it to feel a release or escape. Feeling something physical other than the numbness. Most of my clients that are cutters will express that it's feeling something other than being numb, or it's the release or the escape. And then the last is that it turns emotional pain into physical pain, and sometimes people have a better time focusing on that physical pain versus the emotional. For if you're worried about a friend or parent, if you're worried about a child, these are signs that they may be engaging in self-harm. So avoiding situations that involve showing skin, such as swimming, kids wearing turtlenecks or kids wearing long sleeves. If you have a kid that used to run around the house in, tank tops and short shorts, if they're all of a sudden in long sleeve shirts or long sleeve pants, just ask a couple of questions to figure out what's going on. Hiding sharp objects, spending an extended amount of time alone, struggling to maintain healthy friendships, family relationships, or romantic relationships. Self-harm can be very isolating. Blood stains on clothes, towels, beddings, tissue. If you're anything like me, I have no idea why I can visually remember something is missing. But if you're missing Band-Aids, if you're missing certain, if your child is missing certain clothing, it's like, okay, well, what happened to that shirt? Or why are so many Band-Aids missing? Just ask questions. Unexplained wounds that appear sporadically or in the same places, often on the wrists, arms, thighs, or torso. They are pretty much going to cut or self-harm in places that people can't see, because again, that is the shame associated with the symptom. Because self-harm can be alarming. For, if you find out that someone is self-harming, it can be alarming. Definitely try to help that person, be compassionate. Try not to be judgmental. Try not to fix. And then be honest. I'm very, very honest if something is outside of my just kind of emotional range in that moment. Like, this is a little bit shocking and distressing to me. I don't know if I'm the best person to help you, but I can support you. Who else do you think we can talk to so that I can support you in the best way possible? And my suggestion after that would probably be a professional. But definitely let's talk to someone else. I feel like being, especially if it's someone close to you, letting them know that you don't know how to deal with the situation is perfectly okay, instead of saying something and trying to make things better, but then making them worse because you have no idea how to handle this. And it's not a typical situation. So again, you don't have the toolbox. Okay, so the next thing I want to talk about is suicidal ideation. This is just thoughts or feelings about suicide or self-harm, and it can range from simply considering it to creating a plan. I do want to say that a lot of people don't want to talk about suicidal ideations, which is just fancy way for suicide thoughts. People don't want to talk about it because, again, it's embarrassing. It's a tad bit taboo. But therapists are really trying to get people comfortable with having these types of conversations. I have found that oftentimes people feel backed against a wall and they have no other choice but to complete suicide because of just talking about it has a tendency to distress the people around you. Or because there was a myth that people talked about suicide lightly as a way to gain attention, or they didn't really mean it. People can either take it that way, or they can take it as this really big and ominous thing that, oh no, don't talk about that. That really causes trouble. So, regardless to how you respond to it, try to, again, be supportive, non-judgmental. And I meant regardless to how you responded to in the past. Going forward, try to be compassionate, non-judgmental. And please just tell that person, let's get you to someone professional so we can have a conversation with them. I am really big on validating the way a person feels. You or I can't tell another person how they're feeling, or you don't feel that way. That's really a pet peeve of mine. You just can't tell someone how they're feeling. And minimizing or invalidating feelings can be very, very dangerous. And so I don't like that. It really, it can mess up someone's self-esteem. So I'm going to talk about the suicidal ideations and then talk about the other thing that really makes people nervous. Like, they don't want to go to a doctor or a therapist and talk about having suicidal thoughts because they think they're automatically going to go to the hospital. And so there are two types of suicidal ideations. One is passive. So that's a person has a specific thought of suicide, of not wanting to be alive or not wanting to wake up in the morning, but doesn't intend to plan to commit action. I see this very, very often in people with depressive disorders. So you can see this with people with extreme anxiety also. So the other ideation is active. So a person not only thinks about suicide, but intends to commit the action, and they also plan how to do it. And so the other component to that, to an active suicide ideation, is if the person actually has one, that concrete plan, like I plan to take pills. And two, the third component is having the actual intent to take those pills when you leave, like, for example, your therapy session. And so at that time, it's my job as a therapist to just convince that client to allow me to support them in this moment and get them the help they need, because whenever you have those three components, you're thinking about it, you have an active plan, and you have the intent to follow through on that plan. Okay, that's really scary territory, and we need to get you to a place where we can just kind of help you. Because it's a lot like that urge surfing I talked about in a previous video. It may not be as quick as like the urge surfing, but the urge and the desire to die will pass. Okay. So I do want to point out that not everyone with suicide ideation will act on it. So which is why it's just kind of impossible to predict whether somebody will or won't act on the thoughts. Like, when I first started out as a therapist, I was a nervous wreck. I was like, please don't let me get anyone that's suicidal, because I wasn't sure like what to do in that situation. And it was like, I was still kind of in that new phase where it's like, well, I don't want to upset them. I don't want to, because I'll never see them again and I won't be able to help them. But now, like, I am an older professional. I understand now that if they're upset with me, I'm perfectly fine with that. As long as they're here another day to be upset with me, then, I mean, it works. I'm fine. Be upset, but I will make sure that you're safe and secure. That comes absolutely first. But you just, and so I'm saying that to say that if you're at home trying to predict whether your child will or won't, your friend will or won't, don't do that. Just go to a professional to make sure that person understands that you're trying to support them in the best way possible. So symptoms for suicidal ideation can vary from person to person. However, here are a few things that are just kind of common. The person may not have every symptom, but they may have a majority. So they talk about feeling hopeless or having no reason to live, including telling people that they would be better off without them. They give away their personal possessions, especially things that are just super, super important to them or sacred. Years ago, I had a client give a sibling something that ordinarily, if the sibling touched it, the person would just kind of freak out. And so that was indicative of that person just kind of giving away something that was, precious or personal to them previously. Exhibiting reckless behaviors such as using drugs and alcohol. Sometimes sexually reckless behavior can be added into that. Avoiding social interactions, spending a lot of times with themselves. And I don't want to say that everybody that spends a lot of time alone is suicidal, but if they have depression and anxiety, it's not good for them to be alone anyway, because the brain is super negative, and if you spend a lot of time alone, it's going to get to the point where your brain is suggesting suicide as an option. Increased rage or anger. This can be seen in some people. It chaps my hide when somebody assumes that a person that's angry or full of rage isn't depressed. They're just aggressive. Some people don't know how to express emotions. I said that in a previous video. If I only know sad, mad, or glad, if I was taught that sad isn't important as mad, you know what I'm saying? Like, you weren't taught how to express sad feelings. Some people just see mad or happy. So all I know to express my feelings is anger and different variations of anger. That's what you're going to get. A person appearing anxious or overly agitated. If a person tells you they feel trapped or they have extreme mood swings, talks or posts on social media about wanting to die. Those are very, very important with the younger generation. I just watched a video earlier today of a YouTuber named, I think it's Itika. He was very popular with the Switch gaming, and he left a very long video saying goodbye to his friends and to his followers. And it was absolutely heartbreaking because he struggled with mental illness. And, of course, because he struggled with mental illness, he made a series of poor decision making isn't it isn't the best when you're in a mental health crisis. And so he was embarrassed by those things. Like, once he was clear-headed, he was embarrassed by those things, and he felt as though he made a series of bad choices. And so because he was in that just kind of depressive slump, the only thing he saw was death as a solution. And so it was just very sad to watch. But I don't know who was in his support system, but if just getting help and talking things through may be helpful for some people. There is a gentleman who again, I don't know why I never look up this man's name, but he jumped off the Golden Gate Bridge. And he said the moment he jumped off, of course he survived. He said the moment he jumped off, he knew that every issue he had, every problem he had was solvable. And I love to share that story because a lot of times when people are suicidal, they don't see a solution. The only thing they can see is the problem, and the only thing they can focus on is relief. And oftentimes people have such a negative view of therapy or the mental health system, they don't see it as an option. So there are several things that can just kind of contribute to suicidal ideations. I want to spend this time just kind of educating on the causes, because there's one cause that the one I'm just about to say now, not many people think about it, but a family history of violence or suicide is an indicator that it makes it likely that a person that's suicidal will complete. It's not a guarantee, but it's great. It's a greater likelihood that they will complete suicide if there's already someone in the family that has a history of mental health issues, feelings of hopelessness. And this is not the hopelessness where you feel like you can just kind of shake it off. And if you go with your friends and you eat and you party and you have a good time, you'll feel better. Like, that's not the hopelessness I'm talking about. I'm talking about the hopelessness where a person tells you that they don't see a purpose for themselves or a reason to live, or they don't understand why they are alive, or, you know, nothing good will ever happen to them. I mean, it's a different kind of hopeless. People identifying as LGBTQIA plus with no family or home support. This can be very, very traumatizing for this group of people. It can be, you know, just very traumatizing, isolating. And so what I've done in the past is I definitely try to support my LGBTQIA plus youth by connecting them with a support system, a welcoming support system, an encouraging support system, and a support system that won't make them feel foreign or alien for having the thoughts and feelings that they do. I also try to support by just helping them understand that they don't have to make any final decisions about what they want to do, where they want to go, and how they want to be. And I'm not saying that in the sense of changing their mind about anything, but giving them room to explore however they want to explore. Because again, who they are is it's their identity to figure out. I'm just here as a support person. Another cause can be a sudden loss of work, friends, finances, or loved ones. Finances are really big for some people. People who've had money before and now they don't have money. That's a greater likelihood, especially if they've fallen low in their finances. It's a greater likelihood of them committing suicide. Having legal problems, having physical illness or health conditions, chronic illness, especially chronic pain, can be very, very difficult to navigate because, again, that feeling of hopelessness, of helplessness. I had a gentleman call into the crisis center years ago, and he had a condition in his eardrum where it was a constant ringing. And before speaking to him, I never would have looked at that as something that would distress a person. But this man was suicidal because that constant ringing in his ear, like, I mean, it wasn't ringing like a telephone, but like it was a whooshing sound, and it wouldn't go away. And I mean, he was really distressed, and I was so sad because I couldn't help. Nobody could at that point. So it's a history of suicide attempts. So, you know, if people have like a previous attempt, that greaters the chance that they will complete suicide in the future. Experiencing bullying, especially bullying in this day and age, it's very difficult to deal with. If there are any parents watching this with your kids, I implore you to don't compare your experience with bullying with your child's experience of bullying now, where we could go home and not have to worry about social media or anything coming to our house, and only struggling with or suffering bullying at school or whatever event we were at is so different now. It comes into your house, it infiltrates your entire existence, and so we can't compare the two. And so we have to do something different. And so taking that kid to speak to a therapist to make sure they get the help and support that they need, because the way we used to handle things isn't working anymore. Exposure to suicidal behaviors in others, that goes back to having a family history of suicide, of someone completed suicide, or they've had several suicide attempts. The same with their friends, if they have friends who've had completed suicide or have high suicide attempts. Relationship issues such as breakup or violence, a history of abuse or neglect, experiencing sexual violence or trauma, stress due to racism or discrimination, and a lack of access to quality mental health care. So those things are just really common when it comes to suicide and ideation, suicidal ideation, excuse me. Okay, so the next thing I want to talk about is suicide prevention. And so when you feel yourself like you're having the ideations, you're having the thoughts, you don't have a plan or an intent right now, or you having thoughts and you have a plan, try these 4 things, but not in lieu of seeing a therapist. Definitely see a therapist. Try to identify the situations that may prompt these feelings and jot it down in a journal, or track your triggers. And tracking your triggers just mean the things that the events, whether it's watching television, whether it's a conversation, whether it's re-experiencing a traumatic memory. Write down those triggers, journal them. Consider keeping a journal to keep track of any distressing thoughts or emotions. For me, keeping this journal or tracking these triggers is a part of, a part of a therapeutic process, because those are 2 things I would definitely suggest to a client. Try some self-care strategies such as deep breathing, mindfulness meditation, or physical activity to ease the feelings of anxiety or depression. Definitely being active in taking care of yourself, active in mindfulness meditation, active in physical activity, active in problem solving. Because a lot of times when you're depressed, you just kind of wait for things to go away. When it comes to feeling better, you have to be very, very intentional. Consider reaching out to someone you trust or a family doctor when you first begin to just kind of experience the thoughts and feelings. Your doctor sometimes your first line of defense, and the reason why I mentioned the family doctor also is because they actually do what's called, I think it's a PS9. So they do depression and anxiety inventories now in the doctor's office. I know they do it for adults. I'm not really sure for pediatrics, but if it doesn't matter who you speak to, like you can tell your doctor, I'm feeling depressed. Or if they see your result on a PQ9, what they'll do is suggest that you seek therapy. There's nothing wrong with that. Nothing wrong with that at all. So, if you have someone that is suicidal, here are 5 things you can just do to help with just kind of having the conversation with them and getting them help. So you can ask them directly if you feel like some things they've said were kind of concerning. Are you thinking about suicide? Good. I mean, that's an open-ended question, and they can respond to you. Be there to show support, whether it's in person or on the phone. Depending on how serious it is, and I know that in this climate of COVID and monkeypox, we don't want to get too close to one another, but depending on what that person says, in-person support would be great. Find out if they're safe from firearms or other lethal means like medications, knives, and take steps to remove those things. We do this thing where we call, like in professional settings, we contract for safety. If I have a client that comes in and they say, well, I'm really struggling right now with these suicidal ideations. I felt like a couple of times at home I wanted to take pills. Okay, so let's contract for safety, because this person, the third part, isn't there. They don't intend to kill themselves. They don't want to. So we contract for safety. We identify support people. We identify places we can go to make sure that we're separating ourselves from whatever, if a trigger is in the house. The other thing is, if I have pills and that's what I want to take, let's get all the pills out the house. Let's take them to my sister's. Let's take them to let's throw them out if we can. I mean, I know sometimes you can't because medicine is super expensive, but giving that to someone else or putting it outside in your car so that you have all these steps to take before you get to the pills to convince yourself that that's not the right thing to do. 4 is connecting them with people who can help them right away, which is 911, the suicide hotlines, their actual therapist, or leave those things to the professional, because again, I will say this, a lot of professionals don't want to admit this. Even figuring out whether someone is suicidal is tricky for professionals. So a lot of professionals will say, okay, let's go to the hospital until we figure out what's going on. And then after that, we can deal with implementing some more successful coping skills in the future. The 5th one is, after you've connected that person with someone who can help, follow up with them and offer your support. Like, don't avoid them, because then that freaks them out and it's like, oh, okay, I am crazy. I'm not normal. My friend doesn't want to speak to me anymore. No, don't do that. This is a normal symptom of just kind of having a mental health crisis, or a mental health disorder. So it is very, very common, and it's very much so okay. So this is our last and final video. I have immensely enjoyed making these videos. Hopefully they have been able to help you. Hopefully I've helped to just kind of destigmatize suicide, suicidal thoughts, suicidal ideation. Just normalize it. Have conversations about it. Don't be shy. Parents, if your kids say they're suicidal, they're not broken glass. Ask them questions, support them, seek help, and then just try to keep things as normal as possible. Because I know sometimes when your kid says it or they attempt it, your whole world is upside down. You also speak to the therapist and ask them, what should I do next? How should I behave? What do I do? They will help you through. And so, again, before I go on another tangent, goodbye. And this has been great.